Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone. Welcome back to the Movement Driven Podcast. I'm Dara here with Dr. Greg. How are you doing today?
I'm doing well.
Doing good.
How are you?
I'm doing good. I cannot believe this is episode 40.
I know. We're just saying that it doesn't feel like it.
Yeah, it's
flown by.
Kind of crazy. And you just got back from your little summer vacation in the Cape.
We went to the Cape.
Nice.
We spent a couple days in Boston, the whole fam, the wife's whole fam.
Nice.
It's good.
Did it feel good to just have a little woosah break for a little bit?
I mean, you know how it is. Like, you always need another day to recover from the vacation.
Vacation from your vacation.
Three littles, my joke is it's not a vacation, it's a trip.
Right.
You don't get a vacation. But the wife and I took a day when the kids were in preschool yesterday to just relax at home.
There you go.
Yeah.
Nice. Nice. Well, glad to have you back and glad to be bringing.
Good to be back.
Yep. I'm sure all your patients are happy you're back as well. I know everyone was like
hope so.
a hot commodity. Everyone was like, "Where's Dr. Greg?" And I'm like, "Listen." But it's all good. And today we're going to talk about why your pain keeps coming back and what you're actually missing. So for those times that maybe you can't get in because Dr. Greg is just the hottest PT in Jacksonville, some things that you can kind of consider about why, maybe things keep happening, whether you're not doing PT or you are. So, you see a lot of patients who have said the whole thing. They've already tried physical therapy. They've done chiropractic. They've done this, that, and the third, and they've thought about injections or, they've gotten all these different opinions that are kind of contradicting, and then they're still in pain. So what is the most common thing that you find when you actually dig into what happened with their previous treatment?
That's a loaded question.
I know.
I guess a lot of it's going to depend on what they've tried before, right? But let's put it on as an example of they've tried it all. Mm-hmm. They've even tried some corticosteroid injections. They've tried the chiro. They've tried other PT. They've done as much as you can, and they're still lacking the success or the results that they're looking for. And I think that's what kind of separates us. And that's kind of the sales pitch to get people to come see us, honestly. Mm-hmm. So this episode might turn into that. But essentially, I think what separates Movement Driven is, Movement Driven, let's start with that. Like, why did I name the company Movement Driven? Movement has to be at the center of orthopedic musculoskeletal rehab. Mm-hmm. If you're just going to do passive modalities and do some shockwave and do some dry needling and do some laser and do some deep tissue massage, like all of that has its place. I think all of that stuff that I just mentioned is good. Mm-hmm. But in isolation, it does nothing. If we do not follow the simple premise of diet and exercise as the center of medicine, then we've already lost. We're already behind the eight ball. It's too late. So I think a lot of the time, when people have tried other options, even other physical therapy options, they never get that full movement quality that they're looking for in terms of enhancing the way in which they move, talking to a movement expert, progressing their mobility, their coordination, their motor control, and not just looking at them as a knee patient or a back patient. It's like, no, you're a CrossFitter with this type of injury, and you have all of these other attributes. Let's put it all together and figure out what's going on. So I think, number one, there's never movement as prioritized as it should be in most people's recovery rehabilitative planning. The second is that even when there is movement, and there's poor attention to detail, to sum it up, I think what we do at Movement Driven is really try to separate how you're doing the movement from the specific movement you're doing, right? So it's not just like anybody can tell you to go do bridges and dead bugs, and I will too. If you come to see me for low back pain, you will be doing bridges and dead bugs. And I don't care if that pisses off everybody, like, don't let your PT just do bridges and dead bugs. That's not all we're going to do. Relax. Well, we're going to start with that. We're going to start with that because I got to make sure that your brain can control your musculoskeletal system. What do I mean by that? Okay. People too often just go through the exercises and move the same way in which they've always moved before. Mm-hmm. Sometimes they're moving really well and sometimes they're not. And when they're not, that's what's going to lead to strength changes or weaknesses and mobility issues, and ultimately to a cascade of poor forces go, or too many forces going in a poor direction into the same tissues, and that's how we get repetitive stress injury. So if I tell you, hey, your glutes are weak and we need to start off by doing some simple single leg bridges to activate your glutes, and you go down on the table and you do glute bridges the same way you've always done that exercise. You're like, yeah, I know what glute bridges are. I've done those. Okay, let me go do those. Well, if you're going through that exercise and the entire time you're compensating and you're putting more force through your low back and your hamstrings trying to do too much and your glutes are nowhere to be found, then what did we do there?
Right.
Did we progress you in any way? No, if anything, we've just added to the problem by honing into your compensation patterns and strengthening those movement patterns,
Right.
and leaving your weaknesses further and further behind in the dust.
Yeah.
So when you're going to, oh, I have a back injury, let me start working out. Well, you might be doing the bad thing if you're not getting the right guidance and changing the form in which you're doing things. So I think what separates us, to sum all that up, is we have to change the way in which you're recruiting muscles and the way that your body and your brain are communicating, or else you're just you're beating a dead horse, essentially. So I think that's what we do best in terms of, and what separates us from our competitors, essentially.
Yeah, absolutely. So that was a lot to unpack as well. So
Yeah, I threw a lot at you. I kind of threw the whole episode in a first question,
yeah,
didn't I?
yeah. But let's dive deep a little bit. Deep dive a little bit more. So I've got for the symptom versus source portion of all of that explanation you just gave. Help me understand, and for those who are listening who might think the same way, the difference between treating a symptom and treating a source, because I would agree that for the lame person who doesn't know, from the outside, it kind of looks like treatment. So what is the difference there?
Yeah, so I think this is the biggest sales pitch that you'll find from any of my competitors right now. Like, we have to find the root cause. You haven't found the root cause yet.
Mm-hmm.
To me, that's like PT 101 is finding the root cause. That's what I do. And if you've been to other physical therapists that haven't done that for you, then sometimes people just miss. I've missed before. I know it's a downplay or talk.
Well, you are human. So.
Yeah. Not to talk poorly on everybody in my profession. Sometimes that happens, but I do think it happens too often.
Yeah.
With my profession. And so finding the root cause is things like, for instance, a lot of time people with knee pain, we've talked about this with your personal issue and your history of knee. Now, obviously you've had knee issues that have, predicated your knee pain now, and you've had like traumatic injuries. But for the most part, what people have, especially non-traumatic knee issues, it's usually an issue at the hip, sometimes at the foot and ankle joint, but usually the hip.
Mm-hmm.
It's rarely like just the knee or just quad or hamstring isn't doing it. So it's something above or below that joint. And so when we talk about symptom, well, your symptom is the pain or the swelling in the knee that's telling us there's something going on in terms of a tissue is injured local to the knee joint.
Mm-hmm.
But that doesn't mean it's the cause or the source of the injury. You can do everything to let that tissue calm down, do your ice, do your rest, do your compression, do your nice quad strengthening, get the knee really strong again. But if your hip is moving poorly, then the second you go back to activity and your hip moves poorly again, then it's going to put that same induced stress onto your knee and cause the same injury. Now, even this is kind of what I was saying in the previous question. Even some of my other competitors will say, well, we found the root cause. It is your hip internal rotation deficit. Okay, you found that and you worked on that. But did you actually make change that's going to last? And what I mean by that is, if you just tell the client or the patient to do the exercise and you don't change the way in which they're recruiting their musculoskeletal system via the way the brain is coordinating that movement, and change the form in which they're doing it, then you're not changing anything.
Yeah.
You just identified it, and you might feel better because you took some time off and you've done some massage, but we've just put a Band-Aid on a boo-boo. We have to load the system in the right form repeatedly over a good amount of time to change the system so that you can come out of rehab and feel better than you did before.
Yeah.
It takes time, it takes commitment. It really does.
Yeah, for sure. And I think it's funny here because I have on my notes, like, to give a real example without naming names, but I think we already pointed out me
Yeah.
as this, but
Well,
you know, but a patient of having an area being treated and the area that's actually causing the problem were completely different. So yeah, like you said, I have had 2 knee surgeries.
yeah.
However, there's been, I mean, my first knee surgery was when I was 16 years old in 2010,
Right.
and it is now
So
2026.
there's a series of events and domino effects that have happened
Yes.
since then
Yep.
that we have to figure out.
Yeah. And I think one thing, just from a personal experience with doing this type of PT as opposed to the, 3 sets of 10 that I did while the physical therapist went across the room to go treat other patients while I was like post surgery, is that like I almost every time that we do a session and I'm getting like actual like help with stuff, the next week I'm the weakest in the gym. But I'm always like reminding myself like, oh no, this is how my body is supposed to move.
Yeah.
And because I haven't actually moved this way for 20 years almost, like
weaker 'cause
yeah.
you're tapping your weakness.
Yes. But by continuing to do the movements and the stretches before the workouts, it eventually just becomes like how I move. But that it's always very interesting the first couple of days after. I'm like, why do these 20-pound dumbbells feel like the heaviest dumbbell I've ever picked
Yeah.
up, you know?
To me, that's a great sign that you're moving better
Yeah.
and differently. And maybe not even better is the word there. Maybe differently is the better word. It's been a long movie come back there. So you're moving differently. Sometimes just change is good, right? In anything in life, change for the sake of change can sometimes be a good thing. And so when you're getting in that gym, now you're just by changing, just us having a conversation that day before and going over a couple of concepts. It's not like we did a full workout that last time.
No.
We just talked conceptually. And so you just had a different intention in how you're going into the exercise. And that shows you how much that brain muscle connection is important.
Yeah.
Where just knowing where you're supposed to feel it changes where you do feel it. And it changes, I say domino effect, a snowball effect all the time, but it's not true how there's a cumulative effect over time of really understanding. And that's why I like to educate my patients of this is why you're doing it like this.
Yeah.
This is the way you should be doing it. This is where you should feel it. This is where you should not feel it. Because you take for granted people like, oh, I thought I'm supposed to feel this ab exercise in my low back. No, you're not.
Like, absolutely not.
That's the last place you should feel it.
Yeah.
Maybe. But you just people like that's where they felt it when they were 15 in their high school gym and their PE coach was yelling at them on those Mercer ridden mats.
Right.
They felt their low back because they were doing it wrong then.
Yeah.
And there's the start of their low back pain. And
Yeah.
now that you're at 45, and I'm gonna get you to do a dead bug the right way for the first time in your life.
Yeah.
And it's gonna take you 6 months to get strong. Sorry, time sucks.
Yeah.
I can't sell you the pill that makes you better like that.
Yeah.
But if you do it the way that I teach, I people get better.
Yeah.
They just do.
I saw a meme earlier today that was like, every exercise is a back exercise if you do it wrong enough.
That's funny. I was thinking you're going the opposite way. Like
No.
every exercise is a back exercise if you do it the right way.
Yeah.
Because you could argue that you can make anything into a core exercise.
True.
If you're engaging the entire body.
Yeah, very true. Very true. So let's shift gears a little bit about into what a movement assessment reveals. So walk me through and walk the audience through what you're actually looking for in that movement assessment. What are you seeing that a standard evaluation misses?
Well, I think a lot of times standard evaluation is like, let's test your strength, let's look at your flexibility, and then let's start. I'm looking at quality of movement just as much as quantity. I'm starting with functional movement assessment. How do you walk? How do you squat? What's your balance like?
Mine was horrible.
And then it wasn't that bad. And then we go into, okay, well, let's look at mobility. And then is it a passive mobility issue, i.e. muscle inflexibility or joint stiffness? Or is it a control issue throughout the range? Or is it an end range strength issue? Like there's just so many reasons as to why issues could be arising. And so when I'm looking at somebody, I don't think the patient realizes what's going on in my head. It's like if you were watching a detective with all the wires. Like I'm going, back and forth in my head thinking, well, this happened, so cross this off the list. And I'm constantly like ruling things out while we're going through that examination. It's not the hip, it's not this specific diagnosis, it's either this or this. And then by the end, I'm doing things to kind of hone in and rule in what's the thing that I do think it is, and does this confirm it with this special test?
Right.
So there's a process to the madness. But I think what people miss is that it's that first half of the exam. It's listening to the patient and the history. What makes them better? What makes them worse? When is the pain happening? What's eliciting? Like, that's 90% of it, the actual just history and take. And then the movement quality of watching them move and watching the way in which they do a bridge and a squat and all the exercises I'm about to, how do you do a dead bug? What's your natural way of moving? I have to look at you, get a sense of the way in which you recruit certain muscles so that I can change it and mold it and benefit and give you more movement avenues so that you're not always moving the same way repeatedly, putting the same stresses on the same tissues and getting a repetitive stress injury. So I think it's just looking at quality and being more dynamic with the thought process and not being so textbook with everything. Well, I got to check this strength and this. And it's like you're a person moving three-dimensionally. Like, let's look at that. So, it's got to be quality and quantity all together.
Yeah. So for someone who's listening, who's in this cycle right now, they've tried the things, they've gotten some relief, it keeps coming back. What's the one question they should be asking any provider that they're probably not asking?
That's a really tough question. I think you should be constantly asking your therapist, like, why are we doing this? What's your thought process here? Just curious. And if they can't dictate that, whatever the thought process is, if they can't dictate that, that's a problem. That's a red flag.
Yeah.
There should be a thought process and not just going through motions. And I might agree with their thought process and they might disagree with mine. Did I say disagree wrongly? I might disagree with their thought process and they might disagree with mine. And one of us might be wrong and one of us, but if in grad school and in residency, when we would talk these types of things out, it was always, if you can justify it and make sense of why you're doing this, then that's okay.
Yeah.
Because physical therapy is very trial and error kind of things, unfortunately. Everybody's a little different. Experience adds up to where now I know what's worked for this many people. I'm going to start here.
Yeah.
And if that's not working, I start to pull from other avenues. But for the most part, if your therapist is just throwing stuff at the wall and seeing what sticks, then run.
Yeah. Yeah. All right. Last question. And then we'll go ahead and keep this episode on a close because I think there's a lot of good information and when we could go on forever. But someone listening to this right now and they recognize themselves in everything you describe, what do you want them to do today?
Call me.
Call me, beat me.
Like it's stupid, it's cliche.
Sorry.
Nostalgia. 90s flash. No, honestly, like we have discounted evals all the time. If you're local, come in and see me. Like, see how I might be different. See how we do things a little differently.
Right.
Get a vibe for what we can do within that first hour. And if it's more than you got within the last 10 hours with the last guy, then give us a try.
Okay. Awesome. Right on. Well, there you have it, y'all. This was a great episode, Dr. Greg. Thank you so much. Lots of good information here. And like he said, if you're in the Jacksonville area, come in for an eval. You can submit on our website, movementdriven.com, or you can give us a phone call, or however you like to explore the options. Dr. Greg also does free 15-minute discovery calls where you can chat. So even if you're not in the area and you're maybe curious about, what the best questions should be, give us a call. Ask around.
Often do wellness stuff virtually too.
Yeah, absolutely. Absolutely. So if you guys recognize this in yourself, please come give us a visit. We want to help. We want to get you better and pain-free and out of that movement cycle. So thank you again, Dr. Greg. This is a great episode, and we'll catch you on the next one.
Thanks, Darren. See you guys.
Thanks for tuning in to the Movement Driven Podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.